This afternoon, we're gathered to announce another historic victory for the American people, very important one. Today, the dream of easily transportable electronic medical records finally becomes a reality. For decades, America's healthcare networks have been overdue for a high-tech upgrade, and that's what we're doing. The existing systems are often slow, costly, and incompatible with one another, but with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely vital. You got to do it. Moving from clipboards and fax machines into a new era of convenience, profitability, and speed, and frankly, better health for people. Under the leadership of Administrator Oz, we're officially launching the CMS Digital Health Tech Ecosystem to give healthcare providers, insurers, and software companies the tools they need to empower Americans with a 21st century experience on health. The key breakthrough we've made is getting many of the biggest names in the healthcare and technology to agree to industry-wide standards for electronic medical records. This will allow patients to easily transmit information from one doctor to another, even if they're different networks and using different record-keeping systems. No matter what system they use, they're all transferable. The new standards will also make it simple for patients to access their own personal health records. I don't want to see mine, please. I don't want to see. I don't know about you. They have all sorts of things, sir. They can tell you exactly what your problem is going to be in 6 years. We can do it. You know, they have all these different things. I don't know if they work or not, but I didn't want to hear it. The U.S. Treasury has taken in $150 billion from tariffs, and we'll be adding about $200 billion next month for totals that nobody's ever seen before, frankly.
Was the transparency that occurs when people control their own health records, because it gives people the choice over their own health decisions and over their own lives, and it gives them a sense of responsibility and allows them to measure the interventions. If they change their diet, if they change their exercise, it can show you how many steps you took today. It can tell you if your glucose is spiking. And all of that information will now be available to American citizens.
We are building a robust and safe, I emphasize that, safe system. It's going to protect the data better than we could have imagined. We're going to be able to accomplish goals that all of us wished from day one that would be in place. These pledges are now confirmed. They're signed in public. And you have therefore empowered Americans to own their property, which is their medical records.